Hi, everyone. Welcome to the Check Writers Room. Three GPs, three angles, one hot take.
I'm Yasmin Cruz-Farine.
I'm Shalonda Armstrong.
My name is Sydney Thomas. Let's get into it.
All right. Well, welcome, everyone. Welcome to the Check Writers Room. We have an amazing episode for everyone ahead of us. We have Jewel Burke Solomon with us in the Check Writers Room. For those who don't know Jewel in this ecosystem, I don't know where you've been. How can you not? Jewel is the managing partner at Collab. She is an amazing human, period. And it is just awesome to have you with us on this episode. Jewel manages over 125 million, and we get to spend some time with her as a friend and co-investor. And with that, I think we should also mention that this is our Women's History Month episode. With that, we can get into my hot take, which is actually, I was really disappointed when I heard this. Scott Galloway is the hot take we'll be covering today. Scott is usually someone who brings interesting, informed ideas to the table, but Scott has said that he thinks there should be mandatory maternity leave because the species needs to propagate, quote unquote, but he doesn't believe there should be mandatory paternity leave. And he thinks that it creates resentment and is sometimes abused. So what are our thoughts
Hold
on
on. Scott
this
said this?
perspective?
Scott Galloway said this? Wow.
Scott Galloway said this.
I'm a little disappointed in this. Especially given Scott's, he's been very firm around the male loneliness epidemic and how there needs to be more community for men. Um, and I think paternity leave is essential. And the fact that we still have to even have this conversation in 2026, I think is sad, especially because I think the previous generations, I think they realize now as they're aging how much they missed out on, and they want to kind of course correct. So I'm surprised with Scott with this hot take, but I completely disagree. Scott, if you see this, we may have to have a conversation.
Yeah, I think the important part that we need to bring to the table is this conversation about how men, this like lopsided household that it creates in terms of the labor. When you have a baby and it's the mother's job, and I know this because I just had a baby 6 months ago, if you set up a lopsided division of labor, then it's really hard to correct that. And I know some people feel like, oh, when they're 2 or when they're 4, like if you set that standard early, and we're not talking about postpartum depression. And so it's 1 in 5 women suffer from postpartum depression. So you have what? 20% of women who are going through postpartum depression, and we're encouraging them to do that by themselves. This is what we want to do.
Right. So I listened to the podcast, and Derek, who is his co-host also, or in this podcast, his guest, also seemed very concerned about Scott's take. And his pushback, which I thought was really good, was around also it's like earnings, career earnings. Like a lot of times when women go out for maternity leave, that is when they're getting the biggest hit on their long-term potential to grow in their companies. And so if you're in this big corporation and you decide to take 6 months maternity leave and the guy next to you who started at the same time doesn't take paternity leave when his kid goes out, he has this consistent opportunity to get promoted, to get more money, to continue to grow in that company that you just lost access to. And so by actually enforcing paternity leave, we might be also creating some additional level setting in the workplace around long-term earnings and long-term career potential. I also think that there is like something about the just absolute magnitude of power that a woman is experiencing when she is able to bring a human into the world. And I think it makes guys a little uncomfortable about the fact that this woman just did all of that and didn't actually, like, they needed them, obviously, but didn't need them to actually, like, push the human out and grow the human inside. And I think that insecurity might be part of this too. Like, they're like, just let me go back to work because I don't want to be at home and feel like I don't have like, continue to be like surrounded by the fact that this woman just did something so freaking cool. And now I have to, I'm resigned to changing diapers, which is like also a big job. But I do think there might be some of this like ego hit that he's not being honest about, that paternity leave forces you to be humble.
I hadn't thought about the ego hit that men might experience if they feel like they're not as useful or have not contributed in as meaningful a way. That's interesting. Yeah, I hated this take from Scott Galloway and disappointed really because I think he has been speaking about masculinity in a way that I thought was somewhat productive, but I don't think this particular idea is very productive. And I think it's just it maybe is steeped in his own um, challenges in his own family. It sounds like he didn't really enjoy being a parent in the early years. Perhaps that was his own thing. But for me and my family, I feel like paternity leave, first of all, is just really important. I'm really fortunate and feel a lot of gratitude that my husband works in a company where they do have paternity leave, a really great paternity leave policy. And when we had our first, I feel like paternity leave was great because those first few weeks of him bonding with our son, it it was really important, informative for their relationship. So, it's not just, changing diapers, it's also spending time with this new human, and building that relationship early. So, yeah, it's interesting to kinda hear this take up against some of the other realities of society in terms of the birth rates going down and, you know, people being concerned about the next generation. Seems like we would be supportive of anything that is going to help support families.
It's actually, I saw some research that was bipartisan because the bar can't just be the baby is born. A lot can happen after something so dynamic happens to your body, right? Like you could be readmitted to the hospital. That's something actually capitalist payers care about, right?
Yep.
So, the fourth trimester is really important. And the other thing I'm trying to understand, especially in industries like ours that are male dominated, it's what is this take on it creates resentment? Like we would want to see our founders build cultures where the decision making factor around HR policies doesn't have to do with unproductive resentment, right? It's like what allows someone to come back to the workplace healthy, refreshed, and productive? Coming back to the workplace 2 weeks after having a baby cannot be productive, right? Like that's not the work and the employee productivity we're looking for, right?
I think Sydney's point earlier is interesting because I do think men almost wear this badge of honor, not all, but some, at times when they have a child, that they're not getting any sleep, right? And that they are stressed, right? And I think there is a kind of that identity wrapped up in that, if that is what being a father is. I have seen many new fathers or, they're having their second or third, and they absolutely are not taking more than a week or two away from the office. And they're struggling for the first 6 months, right? They're not sleeping. I mean, half of them aren't eating well. And it's almost like they're also getting kudos for that because they're fighting through the discomfort. And while we know that it's not healthy and we know it's not healthy for their mental health, it's still something that is applauded in the workplace.
Yeah, I would say on the last bit on this, only 15% of American fathers actually take paternity leave. And I read a post by someone most of us know in the industry who came from an institutional firm and starting her first fund. And she said it took her 3 maternity leaves to finally put an out of office, that she did not want her founders and her LPs to know she was on maternity leave. So that's the type of culture that we're creating. We can do better, everyone.
This is like one of the last things I'm doing before I head out on maternity leave. That if it's any example to anyone, I'm definitely taking maternity leave, definitely putting on my out of office. Gonna take several months actually. And yeah, I think it should be normalized. Even for us that are running our own firms, it can feel difficult to step away. But your family is also extremely important. And I think talking about company culture, making sure that you're setting a good example for the young ladies and men coming up, in your firm, wanting to make sure that they also are prioritizing family in the right way. So that's what I'm going to be doing. I'm definitely taking maternity leave, and my husband's taking paternity leave. So forget Scott Galloway and what he has to say.
Love.
So Sydney, what are you reading? What's the story you're watching?
Yeah. Okay. So earlier this year, Axios shared that 40% of Americans are turning to ChatGPT for health-related concerns. I thought that was fascinating because now my question is OpenAI actually the largest healthcare company in America?
That's a hell of a question.
I'll
Uh,
add I'll add one more point to this that I think like kind of like defines what my thought process was here. When I was at my previous firm, we invested in a company that was tackling helping patients become better advocates or become advocates for themselves in hospital systems. And so they were focused on like billing. So oftentimes when you get a bill from the hospital, it's wrong. It's just someone input some data point incorrectly and you end up walking out of the hospital with a I mean, it can be like a $56,000 bill and you're really supposed to have a $500 bill. But if you don't know the intricacies of, healthcare billing codes, because who does, you actually don't have the insight that you need to advocate for yourself and challenge the bill. I was talking to somebody yesterday, literally, the hospital incorrectly coded his stay as inpatient when it should have been observation. And it was exactly this 50K $1,000 difference that actually happened on his bill. How did he know? ChatGPT. He put his bill into ChatGPT and ChatGPT said, "Oh, actually tell them that it should have been inpatient, not uh it should have been like observation instead of inpatient." How would he have known that otherwise? I truly don't know. And so I'm curious about like just the fact that ChatGPT has so much data and so much information on all of the intricacies of our healthcare system, might it actually also be like the best, I hesitate to say best, but a great option for us if it is defined as the largest healthcare company in America.
I think this is an interesting take, and Cindy, I think you may have a point. As I have seen many people, not me, use ChatGPT or Claude as their therapist. So to your point, it is getting a lot of data, and it is almost acting as a practitioner at some point during the journey for folks. So there is an argument, I think, there. I'm not sure how far I want to go with it, but I think there's an argument there.
Yeah,
Yeah,
my
the thing
biggest concern on this is just the privacy, safety component. I think they may very well be or on the road to being a healthcare company just because of the data that's being input, the queries that are going in, but what they do with that information and how they use it in the future, that's, the big question always with these companies.
Yeah, of course, on OpenAI, they have ChatGPT Health that they say they built with 260 plus doctors, built with HIPAA in mind, who practiced across 60 different countries. I think one of the things we're figuring it out as we go along is how are we using the data today, to your point, Jewel, what happens over the long term. And one of their angles is there's an issue to this day with interoperability where you have a lot of different, whether it's your Apple Watch or an Oura Ring, plus, different, I don't know, functional health labs that you have run privately, and how do you bring all that together? And I think there are digital health companies where you can have more insight into like how how are they being secure with your data. But that's one of the things that they say that they're offering that kind of a my chart can't give you, right? Like, because you just have, especially people who are digital forward, your data in all of these different pockets, and there's no incentive for many companies to bring it all together and give you a complete picture.
I think the other thing is, and we'll see this with the progression of AI, is when will we actually get to own all of our medical records, right? Because our medical records are spread out across various health systems that we've all visited over the years, right?
And some of us started on paper, right?
One thing that we do at Symphonic is like we actually really like physician-led digital health companies because physicians have to abide by the code of do no harm, like that Hippocratic oath. And when you're OpenAI, you don't. And so, what are the moral implications of unleashing all of this information to a company that operates by zero rules, truly zero rules?
It's also how do you know that whatever answer they give you is correct? I think that's a, potential harm in that you might put something in, expect that the result is correct. And as we know, sometimes it hallucinates. Sometimes it's giving you information that's not exactly right. So that's another thing for us to kind of be weary of.
I also think that some of what is offered, especially on these Gen AI products, is more emotional resiliency. This is not like a diagnosis. And there's a spectrum of some coaching, like some positive reinforcement. And I think we'll be watching this for a long time to see, there's a recent case around Gemini and unfortunately, trigger warning around suicide. And so we'll be watching how we as a society in a not yet regulated space manage and folks' knowledge of what's emotional resiliency versus truly what is the right medical attention you need for where you are on a mental health basis. So next segment here, we have Jewel, and kind of along this vein of what we've been talking about, you have a deal that we're going to discuss, a recent investment you've made, and let's get into it.
Okay. Yeah, so we recently invested in May, which is a maternal health company. We're super excited. We were excited to lead the Series A for May, which was a milestone for us as it was the first time that we led a Series A. And really meaningful for me personally because I've been looking for a company in the maternal health space ever since I had my son 4 years ago and experienced the dark side of maternal health in this country, unfortunately. With really scary experiences, both in my pregnancy as well as in birthing. So, I was really passionate about finding a company in this space and was really fortunate to find May.
Yay!
So
Congratulations.
I'm very interested because, of course, I invest in the space as well, Jules. So when you were looking at this deal, walk us through how you guys were able to get comfortable and see the growth potential in May.
Yeah, we looked at several companies before we found May, and there were always challenges, I think, to the point of who's going to pay for this? Is this more nonprofit? Particularly as we think about the Medicare population, um, and Black mothers in particular, given the sad realities that we know in terms of Black moms being 3 times more likely to die in childbirth. From a investment focus, that's what we wanted to solve for. And so May stood out to us because, number 1, the team, Maya, the founder, she had a depth of knowledge and expertise in the healthcare industry, having spent over a decade at Pfizer prior to starting May. She also had a stacked executive team. So sometimes, when you're investing early, you just meet the founders. But in my case, I got a chance to meet the entire executive team, all women team, by the way, and all super passionate about solving this problem. It's kind of interesting, but a lot of the maternal health companies that have gotten funded are not run by women, surprisingly. And so that was an important factor to me, that it actually be run by someone who had experience both on the professional side as well as being a mother herself. And then the way that they're approaching the problem, one, doula care as kind of the primary avenue that they're approaching the problem, I was compelled by because I experienced what a doula could do from an advocacy standpoint for me. And so thought, if we can get more people access to doula care, that would be awesome. And there's kind of a interesting development where more states are making doula care reimbursable. And also, they were doing a great job from a business perspective, doubling revenue year over year, really having a strong go to market motion, and figuring out how to manage these value based contracts. Um, where, some people would be pay for service, which I think is the way that this space is should be moving toward. So all of those things were kind of key factors and why we decided to invest in May over some of the other companies that we looked into.
Also, value-based care contracts, getting one of those is so incredibly difficult. It can take
Yes.
sometimes 12 to 18 to 24 months. I mean, the fact that she has multiple under her belt is huge, and they're sticky. And so it's actually much more reputable than a fee by service or pay per, like, out of pocket payment, because you're dealing with, at the value-based contract level, a B2B contract versus a fee for service is basically like a B2C contract. And I love a B2B contract. They're just so much more steady.
Yes. Yeah. The stickiness also was something that was super compelling of the contracts. It was essentially 100% renewal rate. And so that was something that we could get really excited about. So yeah, lots to love about the deal, and especially given the great time I had getting to know Maya as we were doing our due diligence, and her team. Think, you know, it's at the early stage, it's really about the team. And so that's what really led us to want to invest.
You invested as Medicaid is kind of structurally being pulled back on a federal basis and on a state by state basis, that it's complicated. How
Yes.
did you think about kind of the more macro picture around Medicaid in doing this deal?
Yeah, that was actually a big, I would say, potential place where the deal could fall. But if you look at these kind of small pockets, um, doula care, maternal health being one, mental health being another. We were able to get comfortable that there's still enough states who were leaning in and renewing contracts, expanding reimbursement, expanding available codes that May can take advantage of. And we kind of had to look like state by state what's happening and what is their strategy in order to win in these states where there is forward motion.
We were
Right.
looking at just really quick. I The one beautiful bill, which I think both Yaz and Jewel are mentioning or referencing, is such an interesting piece of legislation for a number of reasons. But one of the things that we were surprised by is how much incentive there is for children to exist
Yeah.
in some of these ways, which I think is counterintuitive because there's a lot of other stuff that got cut that is not family first, but there is something about children and childbirth that they really wanted to incentivize.
At the same time, if, for example, in the Obamacare and the ACA category, the average cost of like a birth and a C-section is like a lot of people who were covered before and are no longer covered aren't going to be able to afford some of the care that they need. So while there is great incentive for to, get a tax credit because you had a baby, I think we are also seeing that what happens after the birth and their care, into Jules' company's point, is making sure that after their child is born that you're not readmitted to the hospital because you have a doula. These things I think are separate from that bill.
100%.
Yeah, and one thing I just wanted to hit on is I love what May is doing, and they are a venture backable company in this space. So, you know, Jewel, as you were thinking through, like, how was May showing that they were really like Series A ready for you? And because I think founders need to know, like, you have to really show that you have that real hyper growth trajectory in this space.
Yeah, I think the executive team's background, understanding both the um, cultural and the implications of them doing good work and getting more doula access to more people and bringing down C-section rates and, all of the important kind of the reason why this company exists, all of that is very important, but they also wrapped it in a business model that can grow and scale over time to be a very valuable company. You know, going for these value-based contracts over the pay for service. That's a strategic decision that ensures that they're getting, six-figure plus contracts and that those are renewing year over year. So those types of things are what make, I think, or what make May, a venture backable company. And looking at it from a Series A perspective, being able to see the proof points of, like I said, doubling year over year from a revenue perspective, and having still huge upside and potential in terms of where they can go from here. Those are all the things that kind of went into our calculus in terms of can we underwrite this business to grow to $100 million plus in revenue over, the next 5 years.
I love that you focused on a revenue target. I think that's something that a lot of folks don't kind of like obfuscate is like it just needs to become like a unicorn. It just needs to become like just big, $1 trillion. And I think that can do founders a disservice around like actually being able to build a resilient company that has specific growth expectations to a certain outcome.
Before you go, Jewel, I'd love to maybe zoom out just a little bit. As you go on, the industry is always paranoid, right? Is this a good time to invest? Is it a good time to deploy? As you go out, are you bullish, excited to come back and deploy? Or are you glad you can go, maybe step away, step out of IC?
Um, I feel like time away always brings clarity. Like I mentioned, if I had not taken time away with my son, I would never have found May because when I was away, I was thinking about, man, this was a challenging experience. There have to be companies out that are kind of solving for this. And so I'm excited to see what, new discoveries and ideas I'm going to have while I'm nursing and, staying up at night with the little baby. But I think this is a great time to be investing. And it's a great time to be investing in businesses that are going to be durable up against all of the changes that AI is bringing about. So, even another reason why I think May is so important because AI is maybe going to have slight impact, but mothers are still going to birth babies. You know, if the current government has anything to say about it, more babies will come. So I'm excited to continue to find companies that are going to be resilient in the face of all of the changes that we see, and also very impactful to communities and people at large.
I know, Julie, you have to go, but before you go, would love to know, like, what's bringing you joy right now outside of stepping away?
I think just the fact that I've gotten my firm to a place where I don't have a lot of anxiety about being able to step away. It wasn't the case last time around. I was really nervous about taking time out, but this time I feel like really confident in the team. I'm really excited about what they'll be able to continue to do even when I'm out. So that the fact that I have peace of mind is what I'm really joyous about these days.
Beautiful. Okay. We'll see you on the other side.
Thanks, y'all.
All right.
That was so fun.
It was. I mean, she's amazing.
Too.
I'm glad we give her flowers when we're with her. But in her absence, Jewel is a national treasure, if you ask me.
She
Totally
is. She
agree.
is. And so, what's bringing you ladies joy right now?
Oh,
Well, I mean, as you all know, I kind of have sad and joy kind of, if I'm keeping it real, about the last week. I lost someone in Kaufman Fellows in our industry. There's something called a forum, which is supposed to be s- a work family. And the person who is our leader, unfortunately, at 33 years old, passed away unexpectedly. But the part of processing all of it is um seeing someone who had built a legacy much bigger than venture capital and everyone honoring what a beautiful person and inspiration he was to so many. And so I have been, inspired by what someone could do in such a short amount of time. So that part is bringing me joy, but it's incredibly devastating. He was the glue. He was a leader among leaders, and we'll have to move forward and try to fill what feels like an impossible void.
Yeah.
yes.
Condolences to you, Yasmin, and everyone who knew him. I've heard nothing but great things about him and his work and everything that
Mhm.
he's been able to contribute to just the world, not even just the VC industry, but just how he was as a human. As far as
Yeah.
like what's bringing me joy right now, it's very little odd, but there's been some nice grown music that has been released recently. So, for example, like Jill Scott just
I
released her new album,
Yes.
know. Yes, her new
and
Yes.
album. So
it
excited.
is like food
Finally.
for the soul. Like I'm so happy and excited about her new album. She just released the tour date, so I definitely will be there. How about you, Sydney?
I love that. I'll continue the music trend. Rebirth Brass Band came to San Diego a few weeks ago. They are one of my favorite bands. It's a New Orleans brass band, and so just think like trumpets, um, all the horns just like blasting in your ears. Oh my gosh, it's a spiritual experience for me. I just
Oh.
am I get teleported somewhere. I don't have family in New Orleans, but every time I go, it feels just like the way I describe it to people is like it is like just such a rich place. The food is rich, the culture is rich, the art is rich. Like it's just I feel so almost like overwhelmed when I'm there as like I could never live there because I think I couldn't actually manage all of the richness. Like I need some bland sometimes. But it is just one of my favorite places on earth. And so I'm so grateful that they came here and I was able to experience what it's like to be there for a few hours.
Love
Amazing.
it. All right, ladies. That's a wrap. Always good catching up with you two. But that's it. Women's History Month. We did our episode. We love it. Always thanks to Jewel for joining us. And we'll talk to you ladies soon.
Bye.
Bye.
And that's the Check Writers Room. Special thanks to Natalia Skoko for editing. Subscribe to our newsletter and view show notes at checkwritersroom.com. Leave us a review wherever you are listening.